Good morning. Thank you for starting your day with Good Day Charlotte.
Here's what's ahead on Good Day Charlotte. Fox 46 is talking about hair loss, particularly in women. Coming up after the break, we'll tell you what Ricki Lake is saying about her personal health and how it's inspiring others.
Last year, she was behind the Mask of the Raven. There she is on Fox's hit show, The Masked Singer. And just days ago, Ricki Lake came from behind another mask. She opened up about suffering with hair loss for more than 30 years.
She has cut off all that hair now and is sharing her story on social media. Yeah. Joining us this morning to discuss female hair loss, Dr. Deborah Matthew, because this is something that affects many more women than most people think. 50% of women, as many are affected over their lifetime. This is more common. Why do we only ever hear about male pattern baldness?
Well, you know, male pattern baldness, you can see, it is very common. And for women, when we lose our hair, we don't go bald all the way like men. It's more patchy, it's more diffuse, it's a little bit from all over, and we hide it. It is terribly distressing. It is somewhat shameful, right? We feel ashamed if we're losing hair. Our hair is so important to our self-esteem. It's one of the first things that people see. But this is really common. And I see women a lot who suffer with this, and they often come in bringing a whole baggie full of hair to show me just how much is coming out, because they're worried they're going to be blown off and not going to be taken seriously. But there are a lot of things that cause it, and there are a lot of things that we can do to help.
Well, I want to start with your hat, because it's the most noticeable thing you're wearing right now.
Yes.
And it looks like a normal hat, but it's not.
It's not. So a lot of times women wear hats in order to camouflage, but this is actually a treatment for hair loss.
Wow.
So this is low-level laser light therapy, which is a mouthful, but these laser lights are actually sending energy to the hair follicles. They're bringing more blood flow to the area, they're nourishing, and they're helping the hair follicles to grow healthier, better hair.
You have supplements here also.
Yeah, so nutrient deficiencies are one of the causes for hair loss. So iron deficiency is a really common one. So taking iron supplements and other vitamins can sometimes help. Hormone problems are another really common cause of hair loss for women. So thyroid problems, menopause, perimenopause. So seeing your doctor, having a hormone evaluation is something that can really help for that. Another really common one is, it's got a fancy name, it's called telogen effluvium.
I was hoping you were going to bring that one up today, Dr. Matthews.
Yeah, that's a
He's
mouthful
always talking about telogen effluvium.
Yeah,
So this is just temporary hair shedding, but it is really scary. So what happens is something stressful happens. So maybe you get the flu, or you're real successful with your 2020 resolutions, you lose weight quickly. A couple of months later, you start to shed hair, and it comes out in handfuls, and it's in the shower, and it's in your brush, and it's really scary. And it seems like if it keeps on going, like by next week or next month, you're going to be bald. But the good news is this is temporary. The shedding is going to stop, and it's going to go away all by itself without any treatment. So if you were fine a couple months ago, and now you got shedding all over the place, that's one of the times you actually don't need to be so worried.
Is stress one of the causes? I mean, I know genetics can be part of it too, but is stress even with men, because I know that's something I deal with as well, can that be a factor?
Absolutely. When you are stressed, your body kind of goes into survival mode, right? All the resources go to helping you to survive and get through the stress, and so worrying about your hair it becomes less of a priority to your body.
And it sounds like, you know, I know I experienced some hair loss after I had my babies, because they say you don't shed hair when you're pregnant, and then afterwards all of a sudden you go, oh my goodness.
It's everywhere,
right.
isn't it?
So
all over
sometimes
the
it's
floor.
normal, and sometimes there is a different cause.
And so seeing your doctor to help determine, is it something you need to be worried about? Is it okay? It's going to go away all by yourself is a really great solution.
All right.
And by the way, I've mentioned this, has been years since I've mentioned it, but I've got a thinning spot in the back of my hair. And so for years, I mentioned it one of the first days on the show 3 years ago, is I had this sprinkle. It's a sprinkle hair. It's a hair fiber that magnetically attaches to the hair you have. You don't really see it unless I sneeze, and then there's this cool cloud of black. Anyway, but even the lady that cuts my hair says there's a lot of women that come in that are sometimes ashamed, but there's a lot of products out there that you can use that sort of at least hide it while you're working on some of these other things.
So don't stay at home and feel ashamed. Go out and ask for help.
Yeah, and thank you to Ricki Lake for sharing it so that women can joke about it just like, you know, men always do also. Dr. Deborah Matthew, thank you so much for coming on and sharing with us, as always. Take a quick break, guys. We'll be back in 2 minutes.